a situation where the sacrum literally comes backwards. And because it's wider in the front, it wedges both ilia into inflare. And every single mobility test you do will be blocked. The pelvis will feel like a block of granite. And when they walk, they'll have very little movement. Sometimes they have a transverse plane or a side bending that comes from the hip joints, but there's not this smooth, normative, oscillating movement of the pelvis. So any spring test, anywhere, pubic, sacral, ilia, ischia, any and all of those will be blocked. So I hope it's clear that the axis is front to back, anterior, posterior, and the sacrum simply glides posteriorly, okay? So it does some strange stuff because it shifts the center of mass posteriorly. Well, the person would be a very good retro walker, but they have to walk forward. So because they have to walk forward, then they contort their bodies in an attempt to move the center of mass more forward. And it's that is what causes the pattern that I described. At L5-S1, it's like a tilt because the sacrum forces L5. It's just a non-physiological movement pattern. L5 is very stuck. But then they will hyperflex there and hyperflex just above that, and then they'll hyperextend up at T3, T4, and absolutely lock up in the upper cervical occipito-atlantal junction. And of course, if they're laying supine, you'll find the sternum and the third rib on both sides to be very rigid. Okay? I think that's helpful, and I know that you're going to review that. And yeah, I think we just had a little bit of a language difference. You used the term posterior tilt, and I'm good with that. So I hope you can read my notes. But I did want to clarify that sometimes you look at a person's body and you expect them to fit into a certain pattern, and then you do the spring testing and you find out, oh my gosh, this is normal anatomy. This person is functioning in their ideal because this is their genetic profile for the musculoskeletal system. I had an acupuncturist send her husband. She said he's got horrible kyphosis. We've got to do something for him. The guy was as strong as an ox. He had normal movement in every direction. I had nothing to offer him. I said, live with it, be happy. So let's see. Yes, I was redundant where you asked if it was different to A. That was redundant. And yeah, I hadn't thought of looking at side bending on both sides, but I like that now that I think about it. Let's see. So one more thing, I want to go back to the second most common pattern. The reason the spring test at L5 is stuck is because it's actually gone to end range of extension. So it's a little bit of a departure from a physiological motion pattern. And I know that people can extend their spines in standing and take up all their movement, but this is a situation where it's stuck there, or maybe gone just a little bit beyond normative. I don't know how to cross that bridge by saying, yes, it is physiological, but it acts like non-physiological, where it's actually stuck at end range. So that the body, this is what the body does, and I just want to interpret it so that I treat it effectively rather than just follow rules and regulations. So I hope this is helpful to you, and let me know. Thanks so much, Angela. I really enjoyed your feedback.